I am Nikki Parr, and I serve as the Senior Director of Student Services and Educational Options for Solano County Office of Education. And I have my esteemed colleagues here who are going to introduce themselves.
You guys hear me? Tracy, Lacey, Senior Mental Health Services Manager and the MHSA Coordinator for Solano County Behavioral Health.
Camden, Webb, I'm the Clinical Services Director with Solano County Office of Education.
Okay. And we're going to take a little bit of time, each of us, before we start our section of the presentation to give a little background about our work history, kind of our experiences. I am a former teacher. I've taught general ed and special ed. I am a recovering school principal. I served as a director of student services for one of our local districts for a period of time. And in my current role as senior director at our county office, I oversee our foster youth services, homeless youth services, mental health, school-based mental health programs. I have co-facilitated writing the LCAP. I've written the LCAP and been a part of that process, so done quite a bit of different things within our county office. And I do want to take just a moment and thank, I don't know if Elizabeth is still here, but I do want to thank Elizabeth Estes. I do want to also take a moment to thank the Breaking Barriers staff for providing us this opportunity to come together and collaborate and meet new people and start to really break down some of the silos that we've been talking about so that we can have improved outcomes for all of our students. Solano County brought a team to Breaking Barriers in 2018. Actually, I'm not advancing my slides. I'm not good at this. Let's see here.
Little arrow, bottom right.
Did I get it? Okay, there we go. We came here as a team in 2018 and 2019, and much of that time was spent talking to one another, finding out what our shared goals were, and it sparked a lot of great opportunities for us to plan and be strategic around how we are going to break down our silos, how are we going to bring the ideas and the excitement back to our county. So once again, thank you, Breaking Barriers, for that opportunity. I've heard throughout this conference, over the course of our 3 days, the importance of relationships, collaboration, and when multidisciplinary teams come together to be effective, that we have to have a shared language and goals so that we can have the outcomes that we're desiring. And I am not a clinician, and so, but I have worked with young people who have had significant mental health challenges, significant issues with trauma, and knew that I needed to learn. And so being in that room and building these relationships with clinical staff has been very effective. Next slide here. Okay. So what does this look like? Relationships as the foundation. And I want to give a shout out to Mike Lombardo because in 2014, when I first came to the county office, I had made a connection. I was interested in bringing PBIS training to our county. And we actually met in Sacramento. We were at 2 different conferences, but right across the street from one another, and we met. And when he was sharing his vision, I mean, because I think at that time you might have had just the small number of staff and the small number of programs. But when he talked to me about his vision, and I was able to share my vision, I was just so inspired from that conversation. And the one thing that he said that stuck with me is that if you're going to be able to be successful in meeting your goals, you have to have a solid and healthy working relationship with your county health and social services, and in particular, county behavioral health. So he started asking me questions about what that relationship look like? And we had some challenges. As many organizations have, there had been changes in leadership and different things had occurred. But at that point, I made it my mission to rebuild the relationship and establish new relationships. And in the past, the Solano County Office of Education and our Solano County Behavioral Health Department has partnered on different projects. We were funded under MHSA PEI programs to provide some Tier 1 supports for our students, but we really did feel like we were just scratching the surface and that there was a lot more that we could do. We also have had a long-standing relationship with our Solano County Child Welfare Services, and I actually have staff that are co-located working directly with the social workers. So we had a foundation to start with, which was good. And then my esteemed colleague, Tracy Lacey, came into her position. And that was a game changer for us because Tracy, within a few weeks of coming into her position, she immediately set out to make connections with all of the educational partners. And we set up meetings, meet and greets. Our future superintendent of schools at that time was an associate superintendent. She attended that first meeting. And we started just talking, just getting to know one another. And one example of one of the outcomes for us actually being in the room together is that we looked carefully at the current programs that were funded. We looked at some of our data and our outcomes, and we said, okay, what can we do differently? One of the things that we first started to talk about is how are we funding different positions? And what are different funding opportunities that are out there? And one example of this is that one of Tracy's colleagues at Children's Behavioral Health sent us an email with a grant opportunity from the County Medical Services Program. And I read it and I thought, wow, this is interesting. This is for adult services. We haven't really done a lot of that work, but we did. At that time, we were in the process of establishing adult wellness centers in our adult schools. And so we thought, well, this is an opportunity to be able to partner. County was very honest and open and said, listen, we don't have the capacity to write this grant, but let's partner. And what parts of this can you take on? What parts can we take on? And we actually wrote the grant and we were funded. And so I know later on in the presentation, Tracy and Camden will talk a little bit more about that. But we now have adult wellness centers at our adult school sites, and we're actually able to provide direct services there through this funding. And this would not have been even, this email would never have even come across my desk. We would never have even known about this without that partnership. There's also been opportunities for us to support each other with writing letters of support, being a part of the grant writing team, because I don't know if all of you know, grant writing is difficult. It's time consuming. It takes a lot of coordination and you do need to have partners. So that process, going through some of the grants, there were some grants that we wrote that we were not funded, we didn't get. But what we did was we established and continued to strengthen our relationship. And one thing that we do is we hold each other accountable. We do what we say we're going to do. And we communicate when we can't do that. And I think that that has also helped to strengthen our relationship. And what anchors us is our shared vision to create healthy and resilient communities in Solano County. Okay, so collaboration is the key, as we've said many times. And as I had mentioned, we train on positive behavioral interventions and supports. We've trained about 80 schools in our county on at least Tier 1 of PBIS with the support of Placer County Office of Education and the California PBIS Coalition, so thanks for that support. And behavioral health has been right there with us. So they come to the trainings. They're there to present their system of care. They're there to get to know the administrators and the school staff. So when I mentioned to Tracy, I'm going to have a room with 10 different schools, about 80 to 100 school staff. She's like, I'm there, or I'm going to send a staff person, and we're going to be there, and we're going to get to know one another and more about how your schools operate. We also hold a variety of other meetings where behavioral health is an active member or regularly participates, and that's our monthly student services meetings, where we have representatives from each one of the school districts who are directors of student services. We have a foster and a homeless youth collaborative, a faith and education collaborative, which is fairly new and exciting, and a student wellness center collaborative. And continuing on, there's a lot of support that County Behavioral Health provides to us. So there is a monthly suicide prevention committee, and I am a member of that. I attend. I actively participate in the writing of our 3-year plan and support and provide feedback. I'm able to take the data and the information that I receive at those meetings and provide it back to my colleagues so that they know what's happening in our community. 30% of the MHSA PEI funding is provided to our schools, and we have a small contract with behavioral health to support that. There's also another community-based partner that supports that work. There's also materials and supplies and supports that they provide in terms of suicide prevention kits to schools. Tracy and her team provide an annual update or a template for schools that provide support when they're updating their AB 2022 annual notice. So that's been very helpful for our school districts. And then there's also a transition age youth homeless outreach program that we are actively a part of. We have 45 school wellness centers, 45 in our county. And that is from elementary, middle, high school, adult ed, and our community college. And we've partnered on a variety of different grants. Under the MHSSA grant, Solano County Behavioral Health and SCO and 6 school districts are a part of that particular grant. So we've brought in different school partners to continue this work. And we also collaborate on issues around postvention when we've had a negative outcome. One of the things that I'll say before Tracy comes up is that we are very intentional about building a trusting relationship. Sometimes that means that we are on the phone with each other at 6 p.m., 7 p.m. I think we were on the phone last night, planning, talking about issues, responding to crises and planning whose staff is going to be responding to what school. So we're doing a lot of that navigation behind the scenes. There have been many times when I've been on the phone with Tracy or one of her teammates, used to be Alyssa, and I'd be at the soccer field with my boys while we're talking. So you do have to get creative because I have a full-time position, she has a full-time position, and anytime that we can come together in these mutual meetings, we do, but it does require some outside work on building and maintaining those relationships. And so I'll turn it over to Tracy.
And no. Yeah. Okay, so everybody, I'm super technologically challenged, so this is going to be fun.
This is right here.
Okay, thank you.
Push it. Go right over that.
No?
You gotta push it on there and then push it. There you go.
There you go. All righty, yay. Awesome. So, we thought we needed to just start a little bit with talking about relationship building because honestly, if you are going to be kind of braiding and blending funding, you have to have trust because it's kind of a big deal to do this work. As you saw Mike's spreadsheet, wow, I don't even know what to say. That was impressive. So we did really want to start with that kind of anchor that you have to have good relationships, you have to collaborate, you have to partner, you have to tell each other about grants and funding sources that are coming down the pike. I just got one the other day, and I texted them right away and said, hey, are we in? So you have to really be able to do that. So I did want to, both Lisa and Mike set this up really well for us, so thank you. Like, we really honestly didn't talk, but this is perfect. This slide here is really representing kind of the difference between blending and braiding funding. When you're blending funds, you're just kind of putting them in a pot and you can program out. You can do services and there's not a whole bunch of administrative work on the back end to track all the expenditures and track all the outcomes separately. So a bit more easy to do that kind of work. When you're braiding funding, you are having to be kind of a little bit more intentional about tracking some of the expenditures back to that funding source, tracking some of the outcomes back to that funding source. So what I would want to say to folks is, like, a tip is, if you're blending funds, really lean into the regulations or the requirements that are a little bit more stringent, just to protect yourself. And then just really, if we really want to do the work and carry out the mission of Breaking Barriers and Elizabeth's mission, we have to be very comfortable with taking risks, right? And having our tracking tools, but to get ready to move forward, we have to take risks. So this is kind of an overview or a visual of the many funding sources that we're using right now to support student wellness. So these are the different funding sources that we're leveraging, including the LCAP funding, our MHSA funds. As you heard Nikki share, 30% of our PEI funds go to school-based mental health services. Talk about that here in a little bit. Medi-Cal billing, of course, and then lots of different grants that, again, come down through kind of the behavioral health lanes versus the LEA lanes, so really paying attention and collaborating with each other. And as you can see in this visual here, some of these funds are one-time funds. So if you start something, you have to figure out how you're going to pay for it going forward. So lots of planning is really important. So this slide here, in order to kind of set the stage for taking class to the schools, I have to back up and talk a little bit about how we got here. So in 2017, at the direction and with the support of our Solano County Suicide Prevention Committee, this is a countywide committee, Nikki talked about it, and she's been on the committee for a long time, as has Camden. They wanted us to have a countywide suicide prevention plan. So not a requirement, but hey, we really should do this. So we embarked on a pretty comprehensive community stakeholder process, community forums, focus groups, key informant interviews. We had several focus groups with youth. We had youth come to our community forums. What we heard was that youth really wanted a safe space on their school campuses where they could decompress, talk to other peers experiencing similar stressors, right? So in the initial plan that was published in 2017, we included all the ideas that came from the community, including the youth themselves. And we knew, like, we can't do this right now, but we're going to figure out how to do this, right? So it was really that kind of holding us accountable that this came directly from the youth. So how are we going to go about doing that? I will say that in the section, there's one section in our plan that's specifically for K through 12 schools for suicide prevention. So again, a lot of the content that came from the youth really is in that section. And I'm going to ask you to visualize a garden, if you will, right now, and visualize planting a seed. And then we're going to kind of come back to that in a minute. So parallel to the suicide prevention planning, we initiated an innovation project in Solano County called the Interdisciplinary Collaboration and Cultural Transformation Model, otherwise known as ICCTM. I dare one of you who are tired after eating a smoked turkey sandwich to say that really fast. So this project was really focused on reducing healthcare disparities for 3 communities of focus, the Latino, Filipino, and LGBTQ+ communities. The project was anchored in the culturally and linguistically appropriate service standards, otherwise known as the CLASS standards, community engagement, and quality improvement. Our UC Davis Center for Reducing Health Disparities partners actually conducted a comprehensive health assessment in year 1, year 2. They created a curriculum that blended the findings from the health assessment with the class standards, and then they set about to train multi-sector partners. So there was 3 cohorts of multi-sector partners, 51 people. And guess who got a call at 7 o'clock at night to participate in one of these cohorts? That would be my friend Nikki here. And so, of course, she said yes, I think, to cohort 3. I tried cohort 1, cohort 2. Finally, cohort 3, I got her to say yes. Very busy person here. So anyways, the multi-sector partners were folks from consumers, education, behavioral health providers, law enforcement. We even had somebody from our DA's office, public health, child welfare. And so the groups, as they went through the training, they were then broken up into smaller groups, kind of quality improvement action teams, if you will. And so Nikki found herself at a table with somebody from SELPA, an adult person from adult education, and then another person from her team. And, remembering the work that Mike was doing in his vision, remembering that the youth had talked about spaces on their campuses that were safe, this was the hatching of the Taking Class to the Schools Quality Improvement Action Plan, if you will. So if you can go ahead and think about that garden again, there's a little sprout, right? So we're continuing to water it. And I'm always in the back of my head thinking, oh, this is a great idea. How are we going to pay for it? Right? So in the ICCTM Innovation Project, we did set aside some funds, some innovation funds, to support the QI action plans. And I will say the biggest, there was 14 of these QI action plans, and they ranged from workforce development to training to community outreach and engagement. And by far, the Taking Class to the Schools was the QI action plan that we invested the most money in. So we did use about $900,000 plus to support the 45 school wellness centers that Nikki talked about. Thank you, Mike. It was a big deal. So K through 12, adult ed sites, and even our juvenile justice facility has these wellness spaces as well. So that was kind of a big deal. And that was another 7 o'clock at night phone call where I got this call. What do you think about wellness spaces in juvenile hall? I was like, yeah, why not? Let's do it. Hello, is Toby in the room? MHSA and lock facilities. Okay, so take risks. You have to take risks. It's the right thing to do for the young people, right? So the other important thing about the ICCTM project, it was really grounded in community engagement. And so one of the things that we did, in addition to all the other planning that we did, was that we engaged Solano Youth Voices, of which our friend Alyssum here was the I don't know if we call lead, the supporter of this 100% youth council. And they did the focus groups for the elementary schools, the K through 12 schools, and then a UC Davis student did the focus group for the adult ed site. And so the goal of this was really to hear from the students, what do you want your spaces to look like? What activities do you want there? What kind of people do you want working in the sites? Unanimously, the young people did not want me, a therapist. They did not want me. They wanted peer-to-peer model, which we heard yesterday from our awesome youth panel. And they also said that they'd be interested in college-aged students, people that were closer to their age, right? So this is all things, again, we're planting seeds along the way in order to continue to move forward with what we're trying to do here as a group. So in addition to funding with the innovation funds, the districts were asked to use their own funds to get the spaces ready, so they had to potentially do painting, replace carpets, any construction. They also were asked to fund the staffing for the wellness centers. And so we have worked with them in partnership around how are you going to go about doing that. Harder now more than ever, if you can imagine. And so we have encouraged them. It doesn't have to be a mental health clinician. It can be a bus driver. It can be a cafeteria person. It can be a parent volunteer. We hope someday that it's going to be peers. So you heard the panel yesterday talk about liability, so the schools are like very concerned. Oh my God, you can't have a student talking to another student. Yes, you can. And I almost stood up and cheered when they said the sources of strength. That's a really good peer-to-peer model that one of our districts is using. So we hope to continue to encourage them. Why couldn't they get class credits for doing an hour in the wellness center, especially kids that are on a path to be in the behavioral health field? So lots of seeds being planted everywhere, right? We even are making efforts to get retired educators and health and social services workers to come in, and our faith partners. So when Nikki mentioned the Faith and Education Collaborative, that kind of started with, could we ever get folks from churches to come and volunteer in the wellness centers? And we have to dabble with that carefully with all the legal ramifications. Again, taking risks. And so, I mean, it's not above us. We went to, I think on a Saturday, a luncheon with retired teachers and recruiting people from the luncheon, all those kind of things that we're working on. And Nikki also mentioned a couple grants that they received in order to provide services for adults, for the adults wellness centers. And actually, I'm realizing I'm not moving my slides forward. That's a terrible thing. So these are some images of a couple more wellness centers here. The middle one is actually JDF. The one all the way over to the right is Golden Hills. And I will say the 5 pilot centers opened before COVID, and then schools were closed. And behind the scenes, we then, meaning we funded, and then this team over here did awesome work. It did drive-through events, and the schools came and picked up all their gear. And furniture got delivered in spite of schools being closed. So when we reopened after COVID, there were 40 new wellness centers sitting there waiting for students. So it was pretty awesome. We also have used PEI funds. There are a couple of our programs that were already funded with PEI, so NAMI to do Ending the Silence talks, Solano Pride Center to do Welcoming Schools curriculums. They already have those deliverables in the contracts with us. We're already funding them to do that. They always had a hard time getting into the schools. So now they have these paths in for any of the schools that have wellness centers, and we're already paying for it, so we're scaffolding in services. I'm gonna go ahead. Oh, that's not my slide. What happened? I'm supposed to be showing a clip, a video. No. No, but that says a logo. So Jamie was going to show me this, but no. Dang it. Let me try. See, the technologically challenged person shouldn't be. Is it working? Do you know how to make it work?
Not me. I'm worse than you.
Are you worse than me? Why
Yeah,
is
but-
it that?
But Jamie will do it.
She'll do
She's
it?
coming.
The video's playing, but with no sound. Jamie, I'm sorry. Epic failure. Jamie's a rock star, by the way, if people did not know that. She slid in a video link for me yesterday.
As we return to school campuses, it's important that schools have systems of support for social emotional wellness in place for students of all ages. Solano County Office of Education has been able to secure more than $1.7 million in grant funding to make social emotional wellness a priority and help Solano schools develop student wellness centers on their campuses.
Mental health for students, mental health for adults is so important. We send our kids to school so they can learn, but if they're not mentally healthy, they are really not in a position to take in all the teachers are trying to expose them to. Solano County Office of Education, our clinical program is so passionate about wellness centers. We are collaborating with schools to really adapt the wellness center into their own culture. We know that to really give all kids the opportunity to learn, we need to embed mental health within our community at their school sites. It's not so much about traditional therapy, it's about meeting kids where they're at and giving them skills to maintain. So we want young people to know that there are tons of interventions they can use, and this is the place where they can come and try different things out. So we really want to continue to be advocates for young people and their mental health and take a community approach with addressing stigma that prevents young people and families from getting support with managing mental health. And I can't think of a better way to do that than the wellness centers at our school sites.
We are so grateful for our partnerships and fortunate to have grant funding from the California Department of Education, Solano County Behavioral Health, and the County Medical Services Program to support Solano students and schools in creating these safe spaces where students can connect with needed support and learn coping and stress management skills so that they can effectively learn, grow, and thrive and achieve lifelong success. That's really what it's all about.
Okay, so just to give you a little bit of data before I dive into this. So for the districts that are collecting data for the wellness centers, because, you know, of course, part of our planning, we set up a fairly easy data collection process for students when they're going in and out of the wellness centers. So this school year, since the schools have reopened, 6,487 students have access to wellness centers. 90% of them are reporting feeling better when they leave the spaces. Activities that they're doing when they go there, I think you saw Christian, the staff person, and the kids doing yoga, stretching, listening to music, going to groups that are happening in the wellness center. So it's been a really awesome thing. And we met last week with Vallejo City Unified School District. They applied for and were awarded the most wellness centers. They only had 5 campuses that did not have a wellness center, and they are so impressed with how these wellness centers are helping their students and their school communities that they're now using their own funds to set up the wellness centers in the other 5 spaces. So that's pretty exciting to hear that. So and Mike did say something about MHSA, and I want to just piggyback it for a minute. If you don't know your MHSA coordinator, go meet your MHSA coordinator. That's my role in the county. You have to go to those meetings. While they were all talking earlier in all the different presentations about it being flexible funds, it's flexible as long as the community says that there's a need, and that the community endorses spending those dollars in that way. So just make sure you get very involved in those stakeholder processes. So just setting the stage, because I'm going to hand it over to Camden, who's going to talk about the family that we've been focusing on. So the PEI funds that we use, we fund 2 CBO partners in the Office of Ed. They're doing trainings for school personnel and parents and caretakers. They're doing student prevention workshops, so no assessment or diagnosis needed. These can range from whole classroom SEL groups to individual time-limited groups with 6 to 8 kids. Early intervention treatment, so we are funding 2 of the partners to do assessments and linkage, and then brief counseling in schools. The clinicians are co-located. And then the Wellness Center implementation and sustainability, County Behavioral Health continues to fund SCO to help the schools make sure that they're staying with the philosophy of the Wellness Center, so not being used as punishment, but rather places kids can go decompress. And so we continue to support that. And then I did also, blank. Oh, next school year, the additional thing that we hope to do is not necessarily county behavioral health funds, but we're part of a larger department, Health and Social Services. So the goal is to get public health in there, doing STD prevention, health education, getting child welfare into the wellness centers, doing trainings for parents on child abuse prevention, even getting employment and eligibility to go in and do benefits education. So we really hope to be able to do that next year. The MHSSA grant, thank you to the OAC for funding Solano County with this particular opportunity. So very focused on suicide prevention. So funding lots of training, again, for school personnel and parents on suicide prevention, providing technical assistance for the districts on their suicide plans, their crisis protocols. then the biggest thing that we're doing is school-based mobile crisis services. And I honestly, I can't even say how important it is that we have this. When we applied for the grant, and by the way, it was a really hard grant. Where's Toby? Because they're going to release the money again, and they got to make it easier. We applied in 2019. We had no idea we were going to get this grant, right? And at that time, we got data from the districts. Then there was an average about 2 crisis calls per day across Solano County, 6 districts. Camden's team is going out 5 to 7 times a day now. That's the difference. Pre-COVID, post-COVID. So they've had 216 calls since August 14th. 76% of these kids have been stabilized with safety plans and diverted from crisis stabilization units, emergency rooms, or hospitals. Hugely awesome outcome. And I highlight this because sadly, our suicides, we have a pretty high rate of suicides in Solano County. In 2020, we only had 1 youth die by suicide. In 2021, we had 3 youth die by suicide. And in the first 2 months of 2022, we've matched that, 3 youth dying by suicide. So sorry to be depressing, but this is why we're all here doing this work. And, you know, there was talk earlier about the LGBTQ plus community, so the team is tracking this really closely. 6% of the students that were served identified as transgender, and 31% of the youth identified as a sexual orientation other than heterosexual. So we are tracking this very closely and as a community really trying to address this. There is an activity around screening and assessments for middle school and high schoolers at risk of dropping out. We've not even been able to start that yet because the crisis calls have not slowed down. So county is putting in PEI funds. So we're braiding, right? So we're going to fund a clinician with PI funds to give them more support so that we can get to that upstream screening. And then our screening tool, we added in some early psychosis screening questions. So we're involved in a different innovation project, the Early Psychosis Learning Healthcare Network. So we know how important it is to identify kids when they're very, very young. So that screening tool, we took another risk and we pulled in some of those questions. And we're hoping to be able to identify these kids young. I'm going to go over and hand it over to Camden to talk about the Maxwell family.
How do I move it forward?
Question while you guys are transitioning. My question is, are your local hospitals involved in your prevention work? Not in your like crisis intervention now we're, you know, in the hospital, but in your prevention work, like at the schools, on the ground, in that tier 1, tier 2. I'm just curious.
Kaiser a little bit, probably, and maybe a little bit Sutter, but not as explicitly as they could be.
And Kaiser just recently awarded us a small grant to expand PBIS training for our school site. So that's a new thing, and it's a great opportunity.
So she's just saying Kaiser is helping with some of the PBIS funding and work. So that's great.
Take it away, Camden, otherwise you'll get more questions.
From me particularly. I'm gonna be quiet now.
All right, so I am going to have us revisit the Maxwell family, really kind of building off of the partnerships and the funding and the braiding and what would that look like for the different members of the Maxwell family. So first off, Jordan. So we envisioned that she would have access to her school wellness center. So this is an image from Benicia High School, who has one of the prettiest centers in the county. And so what they did in regards to staffing is they utilized some of their ELO funds amidst COVID, and hired specialists to support. And so the high school has an adult parent liaison who's really well known in the community, so she could have access to that person. Tracy was talking about what we hope to be able to start up, the screening and linkage. So we have if a young person is accessing the tier 1, but we realize that they need additional tier 2 or tier 3 supports, we have a universal screening tool that can also be used as a targeted screening tool. It's electronic, that can be given to a young person on an iPad or on a QR code to their phone. Takes about 15 minutes to complete and spits us out a report that really quickly lets us see the level of care and intervention that they need. And so we envisioned being able to connect Jordan to perhaps a Tier 2 social emotional learning group. In our county, we really based that on what the school's needs are. So we've done a lot of grief groups this year with young people, LGBTQ support groups, anger management, girls empowerment, whatever the need is. If she were to be identified as needing school-based mobile crisis, so schools and law enforcement are the primary conduits in which we get called. So we have an intake line. We just responded to a call about 15 minutes ago I saw on my phone. So we're attached to a Zoom account. It goes to the clinicians. They respond, do the intake, respond within 30 minutes, and then make the determination around whether they can stabilize, which the majority of the time we are able to do, is stabilize the young person, work with the family and the schools right then and there to get services started. But if not, all of our staff are 5150 certified. We have a contract with Medic Ambulance so that the young person no longer has to be transported by law enforcement to the CSU or an emergency room, which has been huge in regards to just reducing the stigma for that young person. And now we're finessing our partnership with Medic Ambulance down to, hey, can you hold off 6 minutes until passing period's over and take them out this door so that the young person doesn't have to be seen and asked a number of questions. So really a game changer for the schools and students in regards to stigma reduction. And then we'd be able to do some follow-up support with Jordan if she gets hospitalized, re-entering into the school. So we've really had the opportunity to build partnerships with the administrations and the school districts around when that young person comes back, not saying, here's your packet of work we need you to have done by Friday, but what can we put aside? How can we be more gentle with them and their family as they're reintegrating into school? Being able to nudge and school districts as well as parents around what's it going to take to get a 504 in place or an IEP in place to support your student. So they would also have access under MHSA. Solano Pride Center in Solano County is funded, does a lot of youth work. Some additional supports, the Solano County Work Ready Certification Program with Jordan being 17, having a part-time job. This program can do resume building, interview practice, as well as highlighting jobs that are willing to take youth and young adults. Let's see, a little bit about the dad. Nikki and Tracy talked about our County Medical Services Program grant that we got. So our first one helped us establish adult wellness centers. We went out for another one and are actually now funded to have case managers and interns embedded in adult wellness center hubs, which is really ideal because those are spaces where transitional age youth are often coming for GED assistance or high school equivalency assistance. And then we also have a lot of undocumented adults who go for ESL and things like that. So it's really considered a very safe space, and the schools really seek to create that. So we've actually just embedded our case managers right there, and it's not just for the students at the adult centers, but really as a community hub. So dad could be able to go there, get some counseling and case management, and referrals to different resources within the community. And being right at an adult site, there's a lot of experts on different vocational training courses, certificate courses, et cetera. So additional supports, we've got parenting classes, triple P parenting, which is kind of a tiered response based on the level of care needed. Our County Office of Ed has been asked recently to do a lot of LGBTQ training, specifically the T we get asked a lot as more young people are coming out. So we've kind of targeted that for administrators, educators, and recently a parenting class explaining how can you support your young person, or if your young person has friends, how can you understand and support. So Eric, he could have access to the Wellness Center at his elementary site. Referral to EPSDT services if needed, and then just coordination at the school site. Vanessa, North Bay Regional Center, referral for care clinic, which in our county is for 3 to 5, what's it? 3 to 6. 3 to 6 year olds. It's a 10-week program for young people who are not able to or in danger of not being able to sustain in their preschool or kindergarten program. So they come for 10 weeks. It's very intensive. There's parent-child interactional therapy, OT, speech therapy, and then some aftercare to help them successfully integrate back into preschool or kindergarten. Then looking at mom, since she's an LEA employee, we know that she would have access to the Employee Assistance Program. And then all of those supports that we were able to wrap around dad, we would be able to offer to her as well in regards to the parenting, trainings, and offerings. And then lastly, grandma. We could connect with some of our MHSA prevention early intervention programs. So we have a peer-to-peer model of support at one of the programs where they can do phone or in-person check-ins or a more intensive case management model. And then also a grandparent support group. So that's how we envision kind of utilizing all of this to support the Maxwell family. And just lastly, the success of all collaboration and implementation of programming comes down to frequent, timely, open communication with our partners. When barriers arise, but also I think when celebrations arise as well. I know we've had many MHSSA grant. I'm just looking at people in the room that I work with on that.